With more pressure than ever to deliver the best care at the lowest cost, health systems are turning to the role of Chief Quality Officer. How can CQOs be effective leaders of change? James Moses, CQO at Boston Medical Center, a safety net hospital, recently took on this role. I caught up with Dr. Moses at the IHI National Forum.
Quality and safety has a moral imperative. I think it's important that the quality and safety lead, the Chief Quality Officer, is a bit of an advocate to ensure that quality and safety is something that's being prioritized, even kind of superseding some of those more fiscal realities.
IHI is developing a theory about what makes an effective CQO, based on dozens of interviews and a review of job descriptions. One of the most important pieces of work is creating a culture to enable and activate people throughout the system. Dr. Moses told me a story about how he tries to foster a culture of improvement by tapping into staff's intrinsic motivation to help patients.
You know, we have, I think, 6 to 8 critical care units, and one of them was an outlying performer, in not the good way. The nurses had been there for years, decades, and had just developed a culture that I think intimidated other people. I was able to engage the nurse manager, who was actually new to the organization and inherited this group. And we decided that actually the best thing, what she suggested to me, was engaging the group directly, specifically the nurses. In that discussion, I weaved in a story about my own personal experience with preventable harm when my mom got in a car accident and was admitted to an ICU and had a CAUTI, an eclampsia, and a C. diff infection. And her outcomes ended up being fine, but those infections complicated her course, and she was in the ICU for 3.5 weeks. And it made basically the discussion with those nurses real. I didn't come in with an edict. I just was sharing to them why I felt these things were so important to prevent for our patients. And in a lot of ways in that discussion, linked it to a mission they already felt very strongly for, which was their own personal contribution to keeping patients safe. And they very strongly felt that. They just didn't understand that these events that happen relatively rarely were things under their control that they could help prevent. And it was a very powerful kind of reinforced lesson for me, where just that direct engagement is really the way to get people to buy in. And that unit went on over the next kind of 6 to 8 months to have the best performance across other units.
Developing a culture of improvement, one that connects people to why they got into healthcare in the first place, is essential to meet the demands of the current healthcare environment. And as Dr. Moses shared, creating that culture requires strong leadership.